The Lancaster County family knows Penn State Health Children's Hospital's neonatal intensive care unit very well. This is where their son spent his first few months. Sarah Scholl has their story. Hi, Sarah.
Thanks, Deborah. At just 3 days old, Ryder Wetzel was rushed to Penn State Health Children's Hospital, but his journey began moments after he was born. Here's Ryder's story. In December of 2014, Ryder Wetzel took his first breath. First-time mom Casey knew something was wrong.
So after Ryder was born, he was put on my chest for skin to skin, and after a few minutes, he started making these grunting noises, and I got a bit concerned, and I kept asking the nurses, why is he making these noises? Something's not right. The next day, they decided to do an echocardiogram, the ultrasound of your heart, just to rule things out. And there it was. He had critical aortic stenosis.
At just 3 days old, Ryder was rushed to Penn State Health Children's Hospital for further care.
Ryder has congenital heart disease, which means a birth defect of the heart, which is the most common of all the birth defects. Instead of there being two good pumping chambers to squeeze the blood out through the two arteries to the body and to the lungs, sometimes we see that one of them grows to normal size and the other one is little.
Typically, this condition is treated with a balloon procedure, but for Ryder, the procedure was not enough.
His left ventricle was severely damaged from all the overworking.
We gave it actually almost 6 weeks to see if the left side could step up and pump a full normal amount, and it never could.
Ryder spent those entire 6 weeks in the NICU.
It was hard because, I wanted to be there from his mom, and I couldn't hold him for weeks on end.
The next course of action was surgery, 3 separate surgeries, starting with a procedure called the Norwood.
What that does is it essentially takes the two arteries that are coming out of the top of the heart and puts them together. So the two sides then pump together and they pump that blood out to the body.
It's just hard to imagine. When you look at this tiny 6-pound baby that you just love so much, just to have their little tiny chest cut open and just how complex that surgery is, it was so terrifying.
He did very well, and then had an extended stay in the hospital. Normally kids can get home after that first operation, but for certain reasons he did not.
Because of Ryder's condition, doctors felt it would be best for him to stay in the hospital to prepare for his second surgery, the Glen.
Those months I was in the hospital, I just got to know Dr. Clark so much more. He would pop in all the time just to see how we were doing. And so I just gained more confidence.
And he went on to have his second heart surgery at around 5 months of age. And that went very well. And that also changed the source of blood flow to the lungs.
The recovery from the Glen was night and day than the recovery from Norwood. It's he just bounced back, and it was literally a week later we were home.
Home at last. A few years later, at age 3, Ryder returned to Penn State Health Children's Hospital for his final operation, the Fontaine.
So to reach that final stage of circulation, the second and third operations happen and rearrange the plumbing for blood flow to the lungs.
For this surgery, Ryder was not alone.
He had this little stuffed animal, this little hamster that he brought with him that we told him he was going to have surgery with him. And I asked Dr. Clark about this beforehand, and he said, of course we can do that. So when he came out of surgery, he was with his little hamster, and they both had little chest scars there, and it was cute because it was his stuffed animal went through with him, and it was really helpful for him.
All 3 surgeries were a success. Today, Ryder is a brother, baseball player, and second grader.
He's just a normal little boy, and anybody looking at him would have no idea.
I'm very proud of him and how he's done, and I'm proud of his family, and very happy.
Enjoying life with him, and trying to give him the world and, show him everything.
Ryder sees a cardiologist every year, and the Wetzels are still in contact with Dr. Clark and the staff at Penn State Health Children's Hospital.
Joining us is Dr. Elisa Bradley, Medical Director, Adult Congenital Heart Disease Program at Penn State Health, and also Dr. Brian Clark, Chief of Pediatric Cardiac Surgery at Penn State Health Children's Hospital. Now, Dr. Clark, before the break, we watched little Ryder's story, an incredible story. So much that family went through. Ryder's family is so thankful to you and the whole team. How does it feel when you get to look and see a child now doing so well?
It feels so special. It feels great. And I had the opportunity to spend a lot of time with him in their extended hospital stay and got very close to their family. And they're very near and dear to me. They're very kind. They send me cards and updates all the time, but it's really great.
Yeah, and I'm sure you're very dear to them too. I mean, you saved their child's life, right? Dr. Clark, what other types of heart defects do you perform surgery on?
Certainly. So Ryder had one of the more complex set of heart lesions that we take care of, something called single ventricle heart disease. But we take care of the entire gamut of congenital heart disease, from the simplest lesions to the most complex, and we do a really nice job.
Dr. Bradley, you treat adults, but adults who have congenital heart issues. And I know you work together with pediatrics because you can often follow these children into adulthood. Tell us about that.
Yeah, it's a good question. I think this is a great story because I think it highlights some of the advances that have happened with modern medicine, right? So newer surgical techniques, interventions, those types of things. And so these children who are born today in 2023 are really expected to live to adulthood. And although they spend 20-ish years in pediatric cardiology, after that they come to us and we sort of look at the long game. How do we get them the next 40, 50, 60 years? And so really the Adult Congenital Heart Disease Program is specialized to look at both their congenital heart disease and then to sort of evaluate whether or not they will have any acquired heart disease throughout life as well.
So again, you're working with adults here. How important is it that viewers start focusing on heart health really from when they're so young until adulthood?
I think the older we get and have more experience, the more we know that we recommend earlier is better. So if you can start new habits in young life and adolescence and young adulthood where you're exercising. If you're smoking, you stop smoking, you don't start smoking, kind of keeping a normal weight. All of those things are going to help, and the earlier that you do it, the easier it is to sort of keep that up through adulthood.
Well, it's interesting because I think as adults, we learn, like you said, as we get older, but we've also learned maybe things we didn't know, our parents didn't know. So it is a little bit easier to then start the healthy habits, at least the ones we know of at the time with our children.
Exactly.
And technology, it's always changing. There's so many advancements. What do you see as the future of, pediatric heart treatment?
Well, as Dr. Bradley said, the surgical management of congenital heart disease is one of the great success stories of modern medicine. Heart defects that once upon a time were uniformly fatal in infancy now are associated with great hospital survival and the expectation of long-term survival with excellent quality of life. So in my opinion, I think the future will show that outcomes continue to improve for these patients.